Welcome to the Weird Works podcast. I'm Dr. Christy, your host. Join us for conversations about alternative and sometimes controversial healthcare topics. This podcast will provide the evidence that you need in order to make informed decisions about your health, to empower you with the facts that you need to advocate for your health, and to encourage you that there is hope your body heals. Join us from experts from all things weird, as well as the testimonies of people with stories of radical healing who were once told that perhaps their condition was a death sentence, that they would just need to live with it, or that drugs and invasive surgery were the only answer. Let's get into agreement that if there is something natural and non-invasive that could be helpful, that it could be your first option rather than your last resort. Hey everybody, it's Dr. Christy and Dr. Christine. So this is actually a follow-up. She's a return guest to the Weird Works podcast. And we just thought that, I know October Breast Cancer Health Month has just ended, but it's still important to keep the conversation going. And Dr. Christine and I were going to just do a professional to professional consult. And I thought we should record it because I'm really just going to ask her questions and she's going to field it and give answers on behalf of what you guys are asking me on a regular basis. So just as a quick recap, Dr. Christine is the doctor who reads our thermography report. So when you get your report, that's her work. And are you a double board certified surgeon?
I am, so I'm board certified in general surgery as well as plastic surgery, and worked as a plastic surgeon for about 12 years. And, I had a special interest in breast cancer patients, so I did a lot of breast reconstruction. And then I was just noticing that my patients were getting younger and younger and younger. And finally, I was operating on women in their 20s for breast cancer. And I just thought, man, something is wrong with this. So that's when I went through the medical research to see what, if anything, women could do. That was probably 25 years ago. And it was kind of before we had any kind of conversation in our culture about natural health. I never had a course in nutrition in medical school or residency or anything, but it turns out it's all diet and lifestyle related. So after learning that, my whole kind of career path changed, and I decided to leave my surgical practice so that I could dedicate myself full time to teaching people how to become and stay healthy naturally and avoid the knife. So that's where my passion about breast cancer grew. And then I got introduced to thermal imaging a long time ago, and kind of thought it was such a fascinating technology because it's really the only kind of preventative technology that we have. And about maybe 7 years ago, I decided to start becoming a physician interpreter. And I work for a company called MedHot, which is based in Florida. And then just in this past year, I actually opened my own thermal imaging business. So I can take the images, do the interpretations, and then kind of help health coach people based on what we find on their thermal imaging.
I love that. That's great because it's like full service from start to finish.
That's right. So I said, you got a full service with me. Yeah.
I love it. Well,
Yeah.
and at our breast cancer health fair, so it was like our 6th annual event. I'm just teaching women like preventative strategies, general health. And then of course the audience is always mixed. We have people that maybe they're at risk, or they have a family member, maybe they're a caregiver, maybe they're a survivor, maybe they're recently diagnosed and kind of figuring out the ropes and what to do and what their options were. Thermography was a big part of the event. And we were teaching that as a just, tool. Like, it's just so life-giving that you can find things 10 years before traditional imaging. And I'm just like, well, that's what the National Cancer Institute has been telling us forever, that early detection saves lives, but this is as early as you could find it.
That's right. It's detecting imbalances rather than cancer. So yeah, we're trying to pick things up at a stage where they're easily reversible with simple diet, lifestyle, and nutritional supplements. So that's the beauty of thermal imaging, is it's a truly preventative technology, where all the other types of technologies that we have for evaluating the breast tissue will only pick up something after you already have it. So I'm like, hey, I'm all about prevention. So that's what thermal imaging is about too.
Yeah, our audience will completely agree with you. Like, we all are preventative, proactive mindset for sure. And I shared my story at the health fair that I had luckily, I feel like blessed that I knew about thermal imaging and had them done, just baseline screenings, maybe every year to 2 years. And so 1 year, suddenly my report went from completely normal, low risk to like one stage above potential like metastatic. And I'm like, okay, what in the world this. And so I thought, well, I'm going to just do what I do to the ninth degree, not panic. And what was really like life giving to me about that intervention was that I was able to feel very responsible about my choices, because what I noticed is that I could get imaging to show that what I was doing was helping. And I think that that's important for women too, because they don't want to feel like they're being irresponsible or
Right.
being neglectful, even though a lot of people in our audience would choose to not do the most invasive, course, right?
Right. Yeah. I mean, absolutely. So, that's the great thing. There's so many wonderful things about thermal imaging, but, for me, like when you're using the Western medicine tests, like, mammography, ultrasounds, MRI scans, again, they only pick up something after you already have it. So, of course, it's extremely disempowering and it's filled full of fear. Whereas with thermal imaging, we're picking up imbalances, again, years before you actually get a structural change. And like I, said, we're picking them up in stages where they're easily reversible with simple diet, lifestyle, and nutritional supplements. And it's so amazing with thermal imaging to see how rapidly we can get rid of those patterns that are an indication of an elevated risk in such a short period of time. A lot of times we can get almost complete reversals of what would be considered fairly high risk within 3 months. So as you said, it's like amazing to be able to actually visually see that what you're doing is making a difference. And because of that, I think because humans are visual, it's, I've noticed that thermal imaging is something that serves as a motivator for people to really stick on a healthy program more than any other thing that I've ever seen. So it's wonderful. Yeah.
I think too, like with that, because I don't mind within 6 months, like my scan 6 months later showed right back to low level risk.
Right.
And I was like, that's fast. Like that's really fast.
Yes. Yeah, it is.
Yeah. And I think in addition to some of those benefits that we're listing, is it really allows people to slow down the clock, right? Because we talk about like when women get a positive mammogram or a positive biopsy, I think it's like a conveyor belt. Like all of a sudden, like time just is on this like fast forward, and it's expected from the medical community that you're just not going to ask questions and you're going to do one thing after the next. And they start lining up all these appointments, and like women quickly lose their autonomy. And I
Sure.
think photography allows you to slow the clock down and kind of weigh your options and just learn about what's going on so that you can be empowered. Do you find that?
Well, there's a couple different scenarios with that, I'd say. So thermal imaging, if we're picking up things, before you have the disease, then that's, of most benefit. If somebody actually does have breast cancer, thermal imaging is something that can be very useful in kind of giving us a indication of what the outcomes, will be. So for instance, if we see that there's a lot of vascularity and things look really hot, that's usually an indication that there's a lot of blood flow there and it's a more aggressive tumor. If we don't see anything on thermal imaging, it's not a failure of thermal imaging. It actually tells us that the tumor doesn't have much of a blood supply and that's very slow growing and that the outcomes are going to be great. And I've seen that pretty much 100%. When we know somebody who has breast cancer and then we get thermal imaging that doesn't show anything. So again, that's an important distinction, I think, because in the criticisms of thermal imaging, I've heard, well, it misses, breast cancers, but the thing is that we don't want to use thermal imaging to mine for breast cancer. We want to use it as a preventative tool again. So we want to be able to monitor your physiological changes over time. And what that means is you need to get regular thermal imaging. So it may be once every 6 months or once every year, depending on what your findings are on the thermal imaging. But it's important to do it regularly because then that allows us to kind of monitor your dynamic changes in your metabolism and your physiology over time. And the moment we see something, we can jump right on it, and again, at a stage where it's easily reversible. And
Yeah.
that's really empowering.
It is, and that's important. I mean, it's like just a scary topic in general. I think that, just fear of that really carries a lot of emotional baggage with it as well. And so, like,
Sure.
more hope and the more empowerment that you can provide, the
Right.
better.
Yeah. And that fear, that's an important, issue too, because I've definitely heard friends of mine who say, "Oh, I don't want to do any thermal imaging. I don't want to know." It like makes you scared. But I have to emphasize, it's like, okay, it's not like a Western test where we're looking for something and you've either got cancer or you don't. It's that we're looking for, those early imbalances and giving, completely empowering you to have control over your health and being able to prevent, serious diseases.
Right. Agreed. So some of the questions that are coming through on behalf of our patients, because at our clinic, we don't cure or treat cancer, but we have women in all different phases of cancer prevention, or even like post recovery after they've done some traditional medicine. And I do have a high number of women with breast cancer right now, so we can
Hmm.
chat the causes of that and what's going on.
Sure.
But I think immediately they want to know that they're being responsible. And I
Mhm.
don't know that they necessarily know who to turn to. So I know I always reach out to you and I'm
Yes.
like, "Oh, scenario, and you've been awesome as a resource, and like you've even connected directly with the patients, which we super appreciate, because I'm always trying to make sure that we have a medical expert on our team alongside of all the beautiful diet and lifestyle and detoxification that we can work on, and supplementation and antioxidants and on and on and on. But we're not medical physicians. And so um do you want to maybe just go through, like, what is your guidance to women? Is it always, surgery, biopsy, chemo, radiation? How do you make the distinction to tell a woman when they can slow down the clock, when they can try natural measures, versus jump to, the natural conveyor belt kind of thing we're saying?
Mhm.
Want to talk about that?
Sure. Okay. So first of all, if a woman is diagnosed with breast cancer, um, breast cancers, there's many different types, so it's not just one thing. And then there's all these different stages, that they can be in too. So um, the decision about what type of conventional treatment that you need to have is based on the stage, the type, your receptor status, I mean, all these kinds of things. So there's a lot of variables that go into determining like what's the best course of action for you. So it's very individual. It's not like there's some, cookbook, thing with it. So the one thing that I think is really important to kind of emphasize is that when you have a breast cancer, we know that if it's something that you can actually feel, it's been there for many, many years. I mean, usually it's been there for about 7, 8 years, if it's at least a centimeter in size. So a lot of women are going to feel the pressure from their doctors, to do something with it immediately. And so they just kind of like feel pushed into the system like that. And so the important thing to understand is, again, it's been there for a long time. It's not an emergency. You have plenty of time just to take your time, take a breath, and investigate all the different kind of venues and treatment courses that they've recommended, for you. And we usually say, hey, you can easily take 3 months, to really investigate, and then make sure that you come up with a plan that really you're comfortable with and that works for you. And it's not going to affect your outcomes, in any way. So you do have, time. Now, what the research shows is if you do a combination of Western medicine techniques with complementary and alternative medicine techniques, you get the very best outcomes. So just going straight Western medicine is, you get some good results with that. Going straight, alternative, it certainly helps a lot. It usually doesn't completely eliminate the tumor. Unfortunately, I wish we could do it that way, but most of the time that doesn't work. But if we do a combination of the two, that's when we get the very best outcomes, with it. And there's things that we can do as far as various different nutritional supplements that can help to take away many of the side effects of the various different chemotherapeutic drugs. So I've been working with women for about 20 years on that specifically, where we we determine what drugs they're being prescribed. We look at what their side effects are, and then we know what nutritional supplements are the things that can help to prevent the various different side effects. So usually they just sail right through chemo. They have no nausea, no vomiting, no weight loss. Their blood counts, stay normal. The only thing we don't do so well is to prevent hair loss. But other than that, usually people can sail right through. So that's like super important, for people to know, because they have such a dreaded concept of what happens with chemo, but it doesn't have to be that way. And then in addition to that, when your doctors are telling you the statistics, so this is a difficult thing where they're going to look at the statistics of, your tumor, its size, what your, receptors are and everything. And they'll say, well, if you do, this is what your chances of survival are. And again, I love to emphasize to women that when the doctors are giving those statistics, that they're actually talking about all the women that are involved in all the different studies, who the vast majority of them had absolutely no coaching on diet and lifestyle or nutritional supplements. Once you start adding those things in, you have an astronomical improved statistical outcome. So I always tell everybody, just throw those statistics out the window, because when you're doing everything else that you can do in conjunction, with that, as far as having the cleanest diet, that you can, getting exercise in, really working on your sleep, maybe meditation to help with, the stress release. And then we add, some key nutritional supplements with that, and the treatments that you were talking about, as well in your office, those supportive ones. Well, then, your chances of survival are just massively improved. So, that's another thing for that I think is extremely important for people to be aware of, is just like, don't take those stats, that the doctors give to you at face value. It's like, know that you can influence your risk tremendously by your diet, lifestyle, and then the key nutritional supplements.
Yeah, I love that. Well, so this is another thing. So what can you empower women with that are listening? They, often they'll go and they go in strong and they try to advocate for themselves and off the get-go, and they tell their doctor and oncologist and the whole team, but I'm going to be doing these alternative therapies, side of it, I'm going to be taking supplements and herbs and so on. And they tell them, oh, you can't, like, those things are going to interfere with the chemotherapy and make it effective.
Well, they always say that, and it does make me really mad, because generally speaking, it's not true. So there's various different things that you can do. So there are people that are professional patient advocates, is the name of them, their profession. And so they can help you as far as helping coach you. I kind of serve that way, too, but this is somebody that can really help you and talk with your doctors too, if you have difficulty talking with your doctors and advocating for yourself. The other thing that I recommend is that there are integrative or more holistic oncologists. And so if you can find someone like that to work with, that's who you want to work with. They aren't as common, as kind of the standard Western trained ones. And if you're in an area where you really can't get somebody that's more integrative, then I tell them not to tell their doctors what they're doing, so they can just make their life easier. Do what they're doing, but it's like, there's no reason to be telling people that aren't going to be open to it. So I just, that's what I tell them to do. Yeah.
We'll be right back after this message.
Are you tired of going from diet to diet to come up short and feel worse than you did when you started? Or are you just lost with all the mixed messaging out there today and not sure what's best for you and your lifestyle? Maybe you were told that you had to live with your symptoms and accept feeling less than your typical vibrant self. Well, I'm here to tell you the truth. As a practicing doctor of chiropractic, kinesiology, and clinical nutrition, I see people all the time that are just like you, frustrated and starting to lose hope. But I do want you to know that you do not have to give up on the you that you know you could be. There is a way to truly achieve optimal health and also to live your life. I want to share with you how, by doing some small, doable adjustments and taking on a new approach to enjoyable and non-restrictive eating, we can help you start feeling better and begin to see changes in your waistline and start releasing weight in as little as 14 days. I've used this analogy before. I'm like, there is no way that whole food supplementation and diet and herbs are going to interfere with chemotherapy. I say that is like me stepping out in front of a freight train with my little hand trying to stop it. Like those drugs are powerful. Like they're going to do what they're supposed to do, right?
Yeah, I mean, they do. And I mean, probably one of the biggest questions that there was about taking and antioxidants at the same time. So there was a study that was done years ago that showed that there were vitamin C receptors on tumor cells that they saw like in a petri dish.
Yeah.
Then they're like, oh, you shouldn't take any antioxidants because there's vitamin C receptors on the tumor cells. And it's like, wait a minute. It's a whole different thing when you have a whole being and you have the tumor in the person and how the behaviors, of things, are. And so there was huge amounts of research that were done looking at doing very potent antioxidants in addition to doing chemotherapy and radiation. And the conclusion was it does not interfere with the effectiveness of chemo or radiation. In fact, it seems to be beneficial, for it. So it helps to protect against the organ damage, that it can cause, and statistically the outcomes are a little bit improved. So that one makes me crazy, when they talk about that. But there's so many kind of misunderstandings of various different things where they, are telling their patients really, really bad advice. But most of it, is kind of misunderstandings. But like you said, a super healthy diet is packed full of antioxidants and anti-inflammatories and, as much fresh, vegetables and whole foods that you can possibly have. And we definitely know that those things are incredibly important for good outcomes.
Absolutely. So do you mind if I go through like some of the, like if it's triple negative, estrogen positive, progesterone, all that, just to kind of talk about what is the best outcome, worst outcome, what's the most aggressive, least aggressive, maybe if you can talk about like.
So there's some receptors, like hormone receptors that will be on the membranes of the tumor cells. And so when you have a biopsy done, they take that tissue and they send it to the pathologist and they do some special staining on there to determine what your receptors are. So kind of the key ones that we look for is, does it respond to estrogen, progesterone? And then there's also a gene that's called HER, HER2, the number 2, NEU, NEU. And that particular one, if it stains positive for that, that is considered more aggressive. If you are estrogen and progesterone positive, that's the best kind of receptor status because it allows us many different kinds of pathways of suppressing the tumor growth. If you are estrogen and progesterone negative and HER2 NEU negative, that's called a triple negative cancer. Usually that happens in younger people, and that's considered more aggressive. Because it's not responding to estrogen or progesterone, then it kind of decreases the number of kind of pathways that we have for decreasing tumor growth. If you're HER2 NEU positive, kind of a cool thing that happened with that is that although it kind of classically is considered a more aggressive tumor, there is what we call a targeted therapy for HER2 NEU. So in other words, when we use chemotherapy, those are generally not targeted therapies because they're just kind of like having an effect on your whole system. But HER2 NEU, there's a medication called Herceptin, which specifically binds onto the HER2 NEU gene. So it doesn't cause a kind of a whole systemic global, side effects to it. There are some side effects, but they're minimal compared to what we have with normal, chemotherapy. But it's specifically targeting, that particular gene that's overexpressing. And so what they find is that because it's so effective with that, we actually get better outcomes because we can use Herceptin. And then in addition to that, so this is just like a great example about how combining Western with a complementary and alternative medicine is so powerful. So there's certain natural substances. So for instance, evening primrose oil, evening primrose oil and olive oil, both will hook onto the HER2/neu gene. And so they both cause the Herceptin to have a massively increased killing effect, particularly evening primrose oil. So it's like a 40 times improved killing effect of the tumor cells when you combine evening primrose oil with Herceptin. So we just have such effective treatments, with that particular type of tumor that, like I said, it used to be, kind of feared because it was more aggressive, but because our treatment is so effective, then it's not, as feared.
Awesome. I love it. That was a great rundown of it, because I think women get all these testing because that's what they're told to do. And then they get all this data. It kind of more paralyzes them than enables them to make decisions.
Right. Yeah. Yeah.
Yeah. Okay. So now that we know that, do you want to go to what the different stages mean?
Sure. So they usually tell you stage 1, stage 2, stage 3, stage 4. And so stage 1 is the earliest. So no matter like how small it is, you're still going to be like stage 1, as long as you have invasive, though they call it, meaning that where they're seeing the tumor cells, it's actually invaded into the surrounding tissue. So I'll just give a distinction about, there's a condition called ductal carcinoma in situ. So that's DCIS. And the doctor who came up with that terminology wishes he never did, because it turns out that it's actually not cancer, DCIS. And so it's a tumor marker. It's telling us that there's an elevated risk of developing invasive cancer at some point, but it's actually not that high. There's like a 3% or 5% increased risk. So because there's so much confusion about it, mammography is something that will actually pick up DCIS. So this is kind of a newer phenomenon that occurred once we were doing mammograms. And so then it's like, well, how are we supposed to treat this? And so because they didn't know, they started treating everybody as if they had breast cancer. And the sad thing is that they actually don't have breast cancer. It's like I said, kind of a tumor marker of the DCIS. Now, there's this really amazing doctor that works at University of California in San Francisco, Dr. Laura Esserman. So she's a surgeon. And so she questioned, why are we treating, women with DCIS as if they had breast cancer? And when in fact they don't. And so she conducted, and this has been a bunch of years ago now, she started a study where what they did was to look at the DCIS, and then they looked at all sorts of different subcategories of them. So what they did is they looked at the pathology of the DCIS, and they found things from where it looked like it was really slow growing and really benign looking to ones that looked more aggressive. And they customized the treatment based on what the pathology showed. So if it looked like it was really aggressive and about ready to become invasive, then yes, they needed, a little bit more aggressive treatment. So anyway, that's the important thing, is to look at the DCIS as like, well, what's the real pathology?
Same thing as stage 0. Is that what we're calling?
That's the stage 0, right? I'm like, again, people say, oh, I had breast cancer. They did a lumpectomy, radiation. It's just like, oh my God, because in that stage, again, that's a stage where we can get things to reverse, so it's like, we want to do a really kind of aggressive alternative, healthy diet, lifestyle, and the supplements and other treatments. And oftentimes we can get it to completely reverse.
I love it.
Now with stage 1, that's when we actually have invasive cancers. And again, they're all over the map, kind of based on what the tumor markers are. And there's a test that's called just a second, Oncotype DX test. So the Oncotype DX test is a test that looks at 21 different genes in the tumor itself. And it's extremely accurate at determining what the level or risk of recurrence would be. So the numbers go from like 0 to 30. If it's like 14 or below, that's super low. And the risk of recurring is extremely low. In the mid kind of section of it, then it's, we kind of look at different factors about what's the best way to treat it. And if it's in the higher, part of it, then usually they want to treat you with some chemotherapy because it's got a high risk of recurring. They will only run that test if it is an estrogen positive tumor and it hasn't metastasized, to the lymph nodes or anyplace else. So it has to be a stage 1 or 2, and it has to be estrogen positive for that test to occur. Now,
can you request it? Can you request that test, or
yes,
is there
yes. Yeah, I tell everybody to request that test. More and more places are doing it. It used to be really hit and miss, and now it's much more of a common thing. It's been around for a very long time. So I don't know, 10, 15 years, maybe longer. So then a stage 2 disease, it's all about the measurements or the size of the tumor. So we want to, if we have really small ones, if that's stage 1, if it's more than 2 centimeters, then it would go into a stage 2. At stage 3, there's metastasis to the lymph nodes. And at stage 4, it's metastasized other areas. So it might be, bone or, things like that.
Right. Yeah. Got it. So then I would assume it's in order to take advantage of these tests and the typing to know outcomes and treatment options, I would assume a biopsy is required.
Oh, yes, absolutely. Otherwise, we don't know what we're dealing with. You have no idea. So you just have to. So that's another, big area.
That's controversial.
Yeah, where people say, oh, if I have a needle biopsy, it's going to cause my tumor to spread. Well, if that were true, then every single tumor that had ever been biopsied, which is like 99% of them, is going to have metastasized. And that's not, what happens at all. Most of them we catch early and they're stage 1 and the outcomes are, excellent. So there was, a lot of controversy about this. So there's been studies done. And so what they did determine was that when you stick a needle in it, sometimes, gosh darn it, they could find that there were some little isolated tumor cells along the track of where the tumor or the needle went in.
Okay.
The thing is that if you have that tumor, usually they're going to take that area out, when you have the lumpectomy done. The other thing is that a tumor is constantly shedding tumor cells into your lymphatics and blood system. We know that. By definition, it's systemic, doesn't matter how early stage it is, we're just constantly shedding tumor cells, out. So your body's immune system is able to recognize those individual cells and get rid of them. It's the hard thing when you got a formed, tumor with, trillions of cells. That's when it's harder for your body's immune system to handle it. But those little isolated cells, usually your immune system is just handling it. So it's the same kind of concept. If there's any kind of spread with it, it's like, well, it's just these isolated cells and your body can handle it. And we do not see an increased risk of, metastasis or lymph node metastasis after a needle biopsy has, been done, statistically. So I think you just don't have to worry about that.
Okay, that's good, because I know some people are trying to find surgeons who will maybe do a lumpectomy or, cut the tumor out, but they're trying to find surgeons who will do that without a biopsy. And what do you say? Right. And then study that tumor in pathology versus a biopsy?
It's a tough one because we want to know ahead of time, like what we're dealing with. Mm-hmm. It's possible. If it's really small, there would be a possibility of, taking it out. But see, here's another thing that'll happen too, where you don't know. So sometimes, like on mammography or on ultrasound or something, the tumor will look like it's the smaller, thing. And there's another type. So most of the tumors are called intraductal, meaning that they start in the ducts of the breast. There was another type that's a little less common called lobular carcinoma that starts in the kind of the lobules, which are where the milk, areas are. And that one doesn't show up very well on mammography. It's more of a diffuse thing. So if we actually do find it, then, trying to figure out what the confines of it are difficult, so once they get in there and maybe they do a lumpectomy, I mean, sometimes they find, oh my gosh, it actually spread out further here and we couldn't even see it because it wasn't forming like a discrete, tumor mass, like that. So that's the difficulties, because you want to be able to plan the right surgery for a person too.
Yeah. And you had given guidance to one of our patients recently. She was trying to do minimally invasive, without as many of the, therapies before or after. And I find that more and more that's what people are seeking. And you're a breast surgeon, you knew what it would look like cosmetically after, and you had told her, well, because of the location of this tumor, like you won't be happy having a because of puckering and all this. And so she's recovering wonderfully right now, but she did have the mastectomy.
Okay. Yeah. Because sometimes like if the tumor is close to the nipple, if you do a lumpectomy in that area, it's going to make your breast look like a donut, with a hole in the middle, and then you radiate it. And then, it looks awful. So there's no point, in doing that. And you can get much better results with reconstruction. Yeah.
Which is something that if somebody's advocating for themselves and trying to call the shots, like they wouldn't necessarily know.
Right.
Yeah.
We'll be right back after this message.
Americans spend $33 billion every single year on diets and weight loss products, and yet diets have a 95% failure rate. These statistics and my 18 plus years experience as a practicing doctor show me the real dangers of a cookie cutter approach to health, and that truthfully, diets don't work. This is why I created the 90-10 lifestyle, for the people like you and me, busy and not willing to settle for less when it comes to our health and wellness. This program isn't just about feeling fantastic and or losing weight for good. It's a roadmap to upgrading your body and mind from the inside out, while simultaneously suppressing the inflammation and suppressing the guilt that often comes with a high stress, high expectations, and high performance. The number one reason the 90-10 lifestyle is so effective and easy to maintain is that it gives you back your willpower instead of forcing it. Okay, so we talked about the stages and the different markers. We talked about biopsy. So this was interesting. The professional patient advocates are like a naturopathic oncologist. Is there a great database or resource where people can go to find these types of options in their area?
I would just Google it and see. So that, there's people that I used to refer to, and it doesn't matter if they're in your town or not, like the main person I used was in New York and another one in San Francisco. And unfortunately, the one in New York died of pancreatic cancer, and then the other one retired from it. So I don't know. I don't have somebody that I standardly refer to, but I would just Google it, and see about who is a patient advocate, and they can help unbelievably well. I mean, the people that I referred to, those folks were so grateful. They said it was incredibly helpful.
Yeah, because you do. Sometimes it's paralyzing to try to go through this, and if you don't have a great support network, or sometimes the spouse might be advocating for or against particular therapies or courses of action where the patient themselves is kind of caught in the middle, and you really support too and encouragement.
Well, that's a good point there too, where I always tell someone who's just been diagnosed with cancer to always bring somebody with them to their appointments, because you're in such a state of shock, you can't hear anything. I mean, it's just it just kind of comes in and goes out, and everybody's like that, So when I would do my initial consultations with people that had been newly diagnosed with breast cancer, and I would do my initial consultation about the types of reconstruction, I'd make it a super short appointment. I'd hardly talk about anything and then I'd have them come back. And it's like, and you had to have somebody with you because you just can't take it in, so you need to have somebody who's not in that state of shock, who can take notes and ask, questions and, like that and help you. Yeah.
That's a good point.
Yeah.
Okay. Last little note that I wanted you to potentially comment on was there's all sorts of awesome documentaries out there. And I think, mostly our patients that are of faith get their hands on these about people that are considered radical healers that had stage 4 metastatic cancer, and maybe some had the surgery, had the tumor cut out of them, maybe some didn't, and then they did all these natural, awesome, amazing things, and really they didn't dabble in it, right? They completely dedicated their entire life to being well again, and gone. What do you want to say about that?
Well, so so as far as different approaches, like I said, if we do a combination of Western with, alternative, that's when we get the very best, results. Now we will hear about these kind of, amazing healings that can occur, with different, healers. It's so rare. I mean, it's kind of like winning the lottery. So I'm just like, I'd rather stack my my odds in favor of me with everything, So I did go to Brazil and see John of God, who is no longer, practicing. But I saw complete miracle healings, and I, would send people down there and stuff too. But so it's possible. I would say another thing that, I'll do is send people to certain clinics, like in Germany. There's one, I live in San Diego, so there's one in Tijuana that I'm very familiar with, and the doctors there that are absolutely excellent. And they do many different approaches, at the same time. And lots of times they recommend surgery. They'll recommend, chemotherapy, but maybe at, like smaller dosages and things like that. Because whenever you have cancer, it is like a life-threatening illness. It's to be taken very seriously. Just doing a few diet and lifestyle changes is not going to do it. You have to do just massive amounts of, supportive things. And this is even if somebody wants to do a lumpectomy and not do radiation, that's when I tell them, hey, you're going to be prepared to be spending, I don't know, $40,000, $60,000, $80,000 going to one of these clinics, doing massive, aggressive, alternative therapies, in order to make sure that you're getting, enough aggressive treatment, for that. So it's not cheap, but it's what's required, to be able to really eradicate, that from your body. But again, statistically, we get the very best approaches when we do a combination, and most of those Western treatments, from the chemotherapy to the radiation, that there are, herbs, supplements, nutritional therapies, IVs of things that we can do that will help to take away the terrible side effects and enhance the killing effects. So it really minimizes any kind of, bad side effects that you would experience from the Western treatments.
Which is important too, because I've witnessed people who have gone 100% just conventional and then tried to come in after the fact, or maybe too late in the middle of all of that. And it's almost impossible to get healing foods and even like juicing and supplements them, because if they've gotten to the point where they have neuropathy and they can't, difficulty swallowing, so it's like we can't get enough of the therapies in them to make a difference at that point.
Yeah, right. Absolutely.
Yeah, so that's difficult. So are there any good blood tests to screen or monitor for cancer?
Well, there are blood tests for various different kinds of cancers, not for breast cancer. There's no reliable blood test for that. But for other, types of cancers, like prostate cancer, is a good example, because they look for the PSA, although it's not, real specific, for it. That's something. We looked like with ovarian cancer, they look at something called CEA. With liver cancer, we can, look at those things too. So there's a few things. And then there's, this is a harder one to get, but they, certain labs and more in alternative type clinics and stuff do something called a circulating tumor cell, count. So they can actually take your blood and then kind of isolate the tumor cells so they can see how much, of the circulating tumor cells that you have.
Okay. And that can be done for breast cancer?
Yes.
Is that also a test to monitor? Because then let's talk about like post therapy. Like, say you're recovering, you had whatever conventional and alternative combinations of treatments, the cancer on, tests look good, but then you're in a wait and see period. And that also has a whole lot of emotional benefit.
Yeah. Well, I always say there's no wait and see period because so I wrote a book called Waking the Warrior Goddess, and it won a National Book Award for the best book in health, medicine, and nutrition when it came out. So it was anything and everything I could find that had any kind of statistically significant influence, either you need to avoid because it increases your risk, or the things you need to favor because it lowers your risk. So there's a massive amount of stuff that you can continually do as far as, like you mentioned, juicing. You can be doing the detoxes. You can be, just making sure your lifestyle is, optimized. I'm a huge proponent of doing meditation. So really integrating all of those things into your life. So it's not just during the treatments of cancer that you do that. It's like a whole diet and lifestyle that you will follow for the rest of your life. So you're continually doing those things and taking, nutritional supplements and so forth. So there's no watching and waiting. It's like a, full on aggressive, your focus on your health, forever, so that you help to, and that's going to minimize your, risk of getting a recurrence.
Yeah. And I love that you said that. Like we said earlier, like this isn't something you dabble in. You don't just like start drinking carrot juice, but then keep the standard American diet and all your stressful maybe hazardous conditions and toxic exposures and all. Like you got to go all in, and it is life. It has to be a forever lifestyle, right?
Yeah, I always coach my patients too, my cancer patients. It's like, okay, if you take a 50,000 foot view on like, why do we get cancer? Like, why do we, or why do we have, human illnesses? And so, for me, it's like, well, from a spiritual standpoint, it's an opportunity, that's a learning, like really, a learning opportunity. And that when people, like lots of cancer patients, will say, the best thing that ever happened to me was having cancer. And you think, how in the world could they possibly say that? Well, because when you get cancer, the opportunity there is for you to do this complete inventory of your life. And you're looking at, do you hate your job? Do you love what you're doing? What about your relationships? And the relationships play a huge role in the risk of developing breast cancer. In fact, of all the things that we know that, kind of are things that promote the growth of breast cancer, the one thing that has more of an effect than anything else, more than diet, more than smoking, more than genetics, are our emotions, and particularly the emotion of feeling loved and supported. If you feel loved and supported, you could smoke and drink. I always laugh. You can smoke and drink and you'll live to be 100 years old. If you have toxic relationships in your life, that's the worst stress on the human body. So, I say, hey, you just be ruthless, about who you allow in your life. And the only people you allow in your life are people that are loving and supportive, like that's it. And you surround yourself with those people. And then you look at every aspect. Can you do anything, upgrade your diet? How's your exercise? How's your sleep? How's your spiritual life? How, all of that stuff. And then you can say, all right, like, I get it. I get where these things were off. And this is where, I can, upgrade or, make a big difference. I also think that doing emotional work is one of the most important things for people to get well, because there's always like core emotional issues at the base of, any kind of, disease that we see. And so I oftentimes send people to this wonderful, she's a psychotherapist, hypnotherapist, counselor. She's in Northern California. Gail Rayborn is her name, but she works by telephone. And one of her specialties is working with cancer patients and just really getting at the root of like, why did this happen? And kind of going through hypnosis. It's like, most people know, why did this happen? There could be some severe stress that happened in a person's life, loss of a loved one, loss of a child, divorce, loss of a job. There's like a 12 times higher incidence of developing breast cancer within 5 years of having one of those major stresses, in your life. But it's very, clear then to you about, why did this happen? What do you need to turn that around? And I don't care what those statistics are that your doctor tells you, when you turn those things around, the likelihood of you having a great outcome is astronomically high. Yeah.
Yeah.
Mhm.
I love that's so encouraging and empowering. It might be hard for people to hear and to be the easiest thing, but detox doesn't just mean diet in your pantry, and
Right.
people detox too.
Do. And it's a very hard, to me, it's the hardest thing is going through the emotional work. To me, physically changing your diet, that's nothing. You can drink some juice or whatever, but getting in there, and working with those emotions, that's a big deal. But, another thing that's super cool, I think in this day and age, is that there's so many different techniques that have been developed that are kind of like instantaneous. So it's not like you have to go to a therapist and do talk therapy for 20 years. It's like there's certain things we'll find that, within our nervous system or how our brain is wired, that there's techniques that we can do that are instantaneous as far as like releasing those, things. That's the way I like to work, but there's many different techniques like that. So I have those in my book, too, as far as the resources that you can find for those various different techniques. Yeah.
And I find it helpful too. We have somebody locally, they are right down the street. Dr. Meg and Dr. Mike do neuro-emotional technique, and that helps out of the, just type A multitasker, spaghetti for the place, control freak. Like, that wasn't helping me. And that was a big part of my positive thermography test a few years ago as well. But
yeah,
it's super powerful.
Mhm.
It is. You don't have to just do talk therapy. I think that's more uncomfortable than some of these subconscious reprogramming techniques that we're discussing.
Yeah, plus it takes forever or whatever. But yeah, I'm like, and I try everything, because I'm just like, oh, this is cool. Let me try that, So I've tried, amazing things. And it's like, yeah, it's just like an instantaneous thing where it's like, oh my God, how's that happen? Yeah.
Yeah, a lot of people, once they go, they tell us that it's literally like within a couple of sessions, we're able to accomplish like what years, sometimes decades of talk therapy couldn't accomplish. I'm like, that's what we want. We are an instant gratification culture. So
no, but you're right. Exactly. And that's what I thought, when I first did, I thought, oh my God, this was like 5 years of therapy packed into one day or something. Yeah.
Well, and this is kind of random, not random, but I kept circling this, like this triple negative cancer that has the worst outcomes because of, it's not linked to hormones and it's not linked to genetics. Do you think that is just the evidence that like all cancers aren't genetic? Like a very small percentage of them, their diet, lifestyle, accumulation of all these stressors, toxins, parasites, immune,
and emotions, right? So yeah, the researchers, came to the conclusion, at least in the realm of, breast cancer, that 95% of the cases could be prevented just through diet and lifestyle changes alone. Yeah, so that, again, super empowering. Our most common cancers are, breast, prostate, colon cancers, and all of those cancers are very similar, and all of them respond to, diet and lifestyle measures extremely well. Yeah.
And all the things that we discussed today are really just part of a healthy diet and lifestyle anyway. It doesn't, I know we're talking about cancer, but you could insert metabolic disease and diabetes and heart disease and chronic pain syndromes. Like, these are the things that are proven to work against.
Yeah. So when I was doing my breast cancer book, the first edition of it, which was back in like 2004, it was 20 years ago. It's in its third edition now. But anyway, when I was researching it, I was like, well, these are all the things that are going to lower the risk of breast cancer, but it definitely is not specific for breast cancer. These are the steps you need to do to have excellent health that's going to avoid every kind of chronic disease. So yeah, for sure.
Yeah. So you could just republish it and not put the Warrior Goddess breast cancer the cover and just say chronic disease.
Oh, there's my second book, which is called Radiant Health, Ageless Beauty. So that's not about any disease, but it's how to, become and stay healthy naturally, which I like. I never learned when I was in medical school, but yeah, so that's how I reformatted it.
I already thought of it. She's there.
Yes.
Okay, well, this has been super informative. It's been a great follow-up to our first podcast. Any last comments before we close for today?
Well, I always like to emphasize that although we talk about all these different things that you need to do, and it might seem kind of overwhelming, it's incredibly simple and easy to dramatically reduce your risk of any kind of chronic disease. So the research shows that when you do one healthy thing, for instance, it will cut your risk in half of breast cancer. If you do more than one thing, those things will multiply up together. They don't add up together. So like a great example is turmeric and green tea. So green tea will enhance the anti-cancer effects of turmeric by 3 times, and turmeric enhances the anti-cancer effects of green tea by 8 times if you're taking them at the same time. So we get these huge kind of multiplications. So really it's unbelievably easy to dramatically lower your risk with just a few, simple changes.
Totally love that. I think that's so empowering, and that's what we're all about, just teaching people, alternative, although I say common sense, I think alternative really is that people learn about it, proactive preventative measures that they can do so that they don't feel like it's not just wait and see or wait for some inevitable diagnosis or disease and then pour on the heroics after the fact. Like it's
Exactly.
more that you can do, right?
Absolutely.
So we will put your book link and your contact information and website in the show notes. So if anybody wants to follow up with Dr. Christine Horner one-on-one, she could be your advocate. She has definitely been an awesome resource for our patients. She will read your thermography. So if we can go over that together, and sometimes we'll pull her in to consult on it. But we'll put all those resources for you to do your own research. I mean, that's what we advocate for you guys, is do your own research and find out for yourself and do what you feel is in your power to do, right?
Yes. Yeah.
Okay. Well, thank you guys all for listening. In good health naturally. This has been another amazing episode of the Weird Works podcast. Thank you, Dr. Christine.
You're welcome. So great to talk with you again.
Your health and how you feel on a daily basis directly impact your mental, emotional, and spiritual health. We will help you reprogram your way of thinking and be on a plan that works for your body instead of against it. It is time to rewrite the false belief that health abnormalities are normal and that it just is what it is. You do not have to live with feeling less than 100%.
We invite you to take a serious look at how you feel on a day-to-day basis. Is what you're doing working? Do you want to learn how to live a more holistic life that's still enjoyable and fun? The 90-10 lifestyle can be the bridge from subpar results to the vibrant and abundant lifestyle that you've been looking for. So click the link by this video so you can get started today. We truly, truly know that this program can change your life. We'll see you on the inside.